The difference between belly button to spine, sucking in, and actually engaging your core, because they are actually different. And engaging your core should feel comfortable. It should feel like you're creating a trunk for your body. You shouldn't have pain in your back or in your lats, or you shouldn't feel pressures in other places. You should just feel in control. So you might have heard before belly button to spine, and so that would be a way that someone might have explained to you to engage your core while you're exercising. So to me, that means like bringing your belly button back towards your spine. And this is what happens when you engage your abdomen correctly, or your inner core unit correctly. It comes in. I'm 6 weeks postpartum, so yay, doing back to exercising. I'm excited. But yeah, just some perspective. When you do engage your core correctly through that core breath that we're implementing, you're going to start with that diaphragmatic breath. Your TVA is going to wrap in, and you shouldn't necessarily feel this in your lower back. You shouldn't feel it in your lats. You shouldn't feel like there's pressures in other places. It should just feel like you've created like a sound unit to work from. When I do that, you do see this where my stomach comes in, and it kind of does look like my belly button is going back to my spine. But I'm not just focusing on that. There's specific and intentional muscle engagement happening, specifically with the TVA muscle, which is again that muscle that wraps from your spine to your pelvis, wraps all the way in to your linea alba, which is this tissue that runs down the middle of your rectus abdominis, which is your six-pack muscles. So we are intentionally engaging that muscle as we are creating a sound core engagement. What we don't want is to simply suck in this way. Like if you're sucking in to take a picture, right? Your stomach does come in, which creates a similar appearance when you're watching me do that. But what happens here when I'm sucking in is there's no intentional muscle engagement. I do kind of feel that in my lats a little bit, and potentially in my back, or like I don't like feel strong when I'm just sucking in, and I'm gonna kind of maybe have a little bit of a rib flare when I'm doing this. So we do want to avoid that. So I guess when you are doing this and you're watching yourself in the mirror, maybe as you're practicing the core breath, to see if you're doing it correctly, maybe from the side or from the front. And one way to feel your TVA, and I have a whole video on how to engage your TVA, but if you aren't sure, just cough quickly. If I'm coughing, you can feel your TVA. Your TVA is 100% engaged when you're coughing or when you're sneezing. So that's the muscle that we're thinking about pulling towards the midline of our belly. So those are the differences.